The DEC mission now includes identifying the children at the earliest point possible, responding to them differently, and providing intervention and different types of services that are more targeted toward the children and the families.
Welcome to the Mid-America PTTC podcast, where we are a community of change leaders and prevention catalysts that strive to empower individuals and communities to promote safe, healthy, and drug-free communities across our region. We're honored to have you as a member of our PTTC community. Thanks for listening and keep up the great work.
Every single one of us is a leader and could be a leader.
It started with a local coalition in our county.
Strategies you know, but stories you don't.
Data is the currency of prevention.
We want to reduce the negative, and we want to promote the positive.
Collaboration is the only way to move the prevention needle.
About connecting the research with the practitioner.
Put something out there that was kind of off the wall and create a community of prevention.
It's a passion, it's a real love to try to help make our world a little bit better, a little bit happier, small pieces at a time.
It's said an overnight success takes 16 years.
If we didn't plan for the change, but if we didn't help orchestrate it, then change is going to be upon us.
When it comes to the spiff, slow is smooth, and smooth is fast. Because the real power is in the process.
Ultimately, all of us want success in the work we're doing. We don't want to do mindless work. Proactive, participatory planning promotes positive, preventive progress.
This is the Mid-America PTTC podcast. I'm your host, Dave Clausen, and I'm the director of the Mid-America Prevention Technology Transfer Center. This is episode 25, and today we're trying something new with the podcast. Through our partnership with the National Alliance for Drug and Endangered Children, we delivered a webinar at the end of January, and folks loved it. It was full of great content about how we can come together to support and serve drug-endangered children. So we've revamped that webinar recording and turned it into a podcast for you. Now, since it's a webinar recording, you may hear the speakers reference the slides, but not to worry. The entire webinar recording is available on our website, and I'll put that link in the show notes. Now, during this episode, you'll gain some awareness about drug-endangered children, the risk they face, and you'll understand the many opportunities that are often missed to identify children living in dangerous drug environments. We'll talk about the benefits of intervention at the earliest possible point to reduce physical and psychological harm to the children. And then lastly, we'll share what a multidisciplinary collaborative response looks like and how it incorporates the unique resources within a community and applies them in a manner that provides better care for drug-endangered children. But before we get into the content, we'd like to thank our funder, the Substance Abuse and Mental Health Services Administration. And a quick note, although funded by SAMHSA, the content of this recording does not necessarily reflect the views of SAMHSA. Without further ado, let's get into today's episode.
Hello, everyone. My name is Eric Nation. I'm the Director of Training and Development for the National Alliance for Drug and Endangered Children. And prior to joining National DEC, I was in law enforcement for a little over 20 years, spending the majority of my time in the narcotics division.
Good morning and good afternoon for those of you in different time zones. My name is Stacy Reed, and I'm the Director of DEC Network Development for National DEC. And prior to coming to National DEC, my background is many years in the child welfare field, focusing at different levels. So welcome, and I'm hoping that this will excite you and get you more involved in your local community and your state.
Let's give you a brief overview of where the DEC mission had started. When National DEC had first originated, It really started around the meth labs, and when meth labs were popular, it was very much so law enforcement driven. It all was based around children being exposed to the meth labs and the contaminations that they were faced during those times. And law enforcement was then identifying children and moving on to working with prosecutors and child welfare. And in the early stages, it was very much law enforcement, prosecutor, and largely about removing children from these dangerous lab or drug environments based around meth labs.
Well, where we are now, because it's definitely expanded and evolved across many, many years. So where we are now is that we're not a law enforcement driven mission. It can start with any discipline. It can start with teachers. It can start with child welfare. It can start with medical. It's also a community driven mission, knowing that it's going to take all of our disciplines to help impact these children in a positive way. No response driven, meaning that it can start with the identification. It can be proactive and not reactive. And expanded to all the disciplines. And when we say all the disciplines, it's any discipline that can come in contact with children, because it's going to take all of us to impact these children's lives in a positive way. The DEC mission now includes identifying the children at the earliest point possible, responding to them differently, and providing intervention and different types of services that are more targeted toward the children and the families. Also, this mission may not include doing a removal of children. So I know when we first started DEC efforts, that removal was really necessary because these children were living in dangerous lab environments. And we know that that's not necessarily the case anymore. So it may not include removing a child. It may include just working with the children and the families, making sure that they're getting their needs met. Also includes all disciplines working together in the best interest of children and families. So just to kind of give you some of the information, and this is part of our core DEC training, the next handful of slides. So National DEC's mission is to change the status quo by empowering practitioners to identify and respond to children living in dangerous drug environments. You guys already respond in some way. We are just hoping to get you to think outside the box as to how we can look at this differently, how we can respond differently, how we can identify these children at an earlier point, and how we can change the trajectory of these children's lives in different ways. When National DEC became a nonprofit years ago, we knew we had to get everybody on the same page and define what drug endangered children are. So we define drug endangered children as children who are at risk of suffering physical or emotional harm as a result of illegal drug use, possession, manufacturing, cultivation, or distribution. When we started, we thought that that encompassed everything, but what we realized is that there are lots of legal substances that also impact parenting and place children at risk. So we then added that they may also be children whose caretaker's substance misuse interferes with the caretaker's ability to parent and provide a safe and nurturing environment. So moving forward, when we talk about DEC efforts or drug endangered children, we're talking about any substance, whether legal or illegal, that impacts parenting and places children at risk. So we are talking about marijuana, we are talking about alcohol, we are talking about prescription drugs. We're talking about any substance that impacts parenting and places children at risk. If a parent is huffing paint and that's impacting their parenting and placing children at risk, we're talking about that as well. We also knew that we had to bring people together with a common vision, something that we can all focus on, give us a light at the end of the tunnel and keep us moving. So our vision is 100% healthy, happy, and safe children. Now, we know that we're not going to get to that 100% in my lifetime or your lifetime, because substance abuse has been impacting children for many, many years, and it's not going to go away. But if we don't start getting on the same page and focusing on 100% of the children, there are going to be many children continuing to fall through the cracks, and that can no longer be acceptable. So with that being said, 100% can also be that you as professionals and as community members also give 100% of you. when you come in contact with a child and their family. And we're not talking about spending lots more time with children. We're not talking about spending more money. We're really just talking about thinking outside the box as to how we can impact children when they are present with us and when we come in contact with them in different ways. And it can be that you are sitting on the floor doing the interview instead of sitting at a table. It could mean that maybe law enforcement is assigning a DEC officer when they do a search warrant, somebody that can focus on the child and impact them in a positive way, because we know that that can be very traumatic. Thinking outside the box as to how we can impact these children and move them towards that 100%. So what are we talking about? How many children are actually being impacted? Is it a little bit? Is it a lot? So we know that 1 in 8 children live in households with at least one parent who has a substance use disorder. We also know that 1 in 10 children live in households with at least one parent who has an alcohol use disorder, and 1 in 35 children live in households with at least one parent who has an illicit drug use disorder. So when we talk about these statistics, keep in mind that these are only children and families that have been identified by one of your systems. So whether it's identification through law enforcement, through child welfare, through the treatment providers, we know that there are a lot of children and families who haven't been identified, but this will kind of give you an idea of how many children we're talking about.
We also know that children whose parents abuse alcohol or drugs are also 3 times more likely to be verbally, physically, or sexually abused. Many of us understand what verbal, physical, and sexual abuse looks like. We also know that these children become 4 times more likely than other children to be neglected. When we bring up this statistic, myself personally, as I was going through my law enforcement career, had to take a hard look at this. As many of times that I had frustrations, and disciplines have frustrations with other disciplines, one of my biggest frustrations early on in my career, pre-DEC, was with child welfare and not understanding, and the frustration that came with talking different languages. So my challenge to you as attendees of this webinar is, do you know the definition of neglect by your child welfare standards? We all have our idea of what the definition of neglect is, but do you really understand the definition of neglect by those disciplines and practitioners that are assessing the risk and safety around neglect on a daily basis? And that would be, do you understand the definition of neglect by your child welfare standards? We also know that children of parents with substance use disorders have a higher likelihood of developing substance use problems themselves. This is kind of that children see, children do. And I'd like to give an example of myself in my law enforcement career. These were the children that we would run across on a daily basis during a traffic stop, a search warrant execution, or however we may have come in contact with them. And oftentimes we would pick these children up and hand them off to our partners. And commonly, what would go through my mind, not out loud, but through my mind was, I'll see you in 15 years. We don't take the opportunity to look at these children and tell them in our minds or even out loud, I am going to do everything in my power to change the trajectory of your life starting today. So we know that children plus drugs equal risk, with some kind of risk affecting all children in some way when you have the children and the drugs combined. Risk is the chance of something going wrong. That danger, that injury, damage, or loss may occur. We also know that all drug-endangered children are at risk, but how much risk and for what varies. As this might not be in our scope of work for our discipline, we have to understand that there is a discipline or disciplines out there that are assessing that risk on a daily or by each event that is occurring. And it might not be all of our jobs to assess if it's high risk or low risk, but our jobs are to provide as much information and evidence possible so those other disciplines can make that proper assessment.
We're going to briefly talk about some of the prenatal risks. So what we know that the effects of prenatal drug exposure are difficult to isolate due to a variety of reasons, including poor prenatal care, poor nutrition, prematurity, adverse postnatal environment. But what we also know is that it depends on the substance being used, the frequency, duration, and quantity. It makes a difference if mom uses methamphetamine versus alcohol versus heroin versus marijuana. It makes a difference if mom uses in the first trimester versus the third trimester. It also makes a difference if mom uses daily versus mom having a couple chances to use during her pregnancy. The good thing is that we as professionals don't have to understand the intricacies of all of this. What we have to understand is that we have to get the word out and educate the parents that are in their childbearing years and let them know what these risks are. Because oftentimes we Google, we go to educational seminars, we educate ourselves on what those risks are, whereas some of the parents that are using may not have that opportunity or they may not be doing that. So we have to take those opportunities to educate folks as well. And that may be that we provide them a pamphlet with information. We offer services. It may be that we get them into treatment. It may be that we just offer the information that we have so they at least have more information than when we started. So just some of the issues that may result from prenatal exposure to drugs, language difficulties, cognitive deficits, long-term delays in development, behavioral concerns, the ADHD, the ODD. Obviously, this is a short list. We're just trying to give you examples as to what some of these delays are, but also keeping in mind that these children are not only impacted during pregnancy, they can often be impacted throughout their entire life. And I think we have to continue to remind ourselves and to remind our other professionals and the parents that these children are impacted forever oftentimes and can have a very difficult life. So obviously, the earlier we can identify and impact these families, the better. So we do know that infants exposed to drugs in utero are more likely to be abused and neglected after birth. So this increase is about 30% due to a variety of reasons. You have high-risk parenting if there's still substance use, and you also have high-risk babies because these are oftentimes not the easiest of babies after they've been exposed in utero. So now we're going to talk about some postnatal, so after birth risk examples as well.
We want to discuss what some of the risks are of substance use and abuse and drug activity that impact these children. The first one that we like to bring up is what we call environmental chaos. If you've ever been in a residence that substance use or abuse has been occurring, you know that the environment oftentimes is very chaotic. It is important that us as professionals document this chaos, whether through evidence collection, through information, through gathering, or definitely making it into all of our reports. Because these are oftentimes the children that leave these environmental chaotic environments and then go to school, and at times or oftentimes can be labeled as the bad children, the ones that are acting out, when in fact, they're the ones that are going to school and trying to recreate that environment that they are used to, that chaos. So really, they aren't the children that are acting out or bad children. They're really kids that are just trying to create that environment that they are secure with.
When we talk about lack of supervision, we can see this in a variety of different ways, depending on which discipline your viewpoint is coming from. So oftentimes these children will be left alone at home without supervision, while mom and dad leave the home for a variety of reasons. Could be going to pick up the drug or buy the drug or sell the drug. It could be that they're left in the car while mom and dad use somewhere else. It could be a variety of different things. So I would just encourage you to think outside the box as to how lack of supervision can happen for these children.
I'd like to bring up the example. One thing that we commonly missed as law enforcement in the community that I was working was oftentimes we would conduct traffic stops. And during those traffic stops, if there was an arrest, or even if there was an arrest, there was always signs of children in vehicles, but the children were not present. So I like to challenge law enforcement to think outside the box and to think about something a little bit different. If you're executing an arrest and you're doing a vehicle inventory form to identify the items that are in the vehicle, if you come across an item that shows the possibility of a child being involved, like a car seat, school bag, etc., are you following up and trying to identify those children and where they are at? Oftentimes we get told that, hey, the child who isn't present in the car, is that the uncle's house? Is that Uncle Tim's house? My challenge is if you go to Uncle Tim's house and try to follow up to make sure the child is there, I think we would be shocked the number of times that the children are actually not where we're being told. And for example, we did go to a residence at one time and knocked on the door, and the child wasn't present at the residence that we had been told that they were. So we followed up and then went to the most logical place, which happened to be the residence of where they live. And we went there, we ended up identifying and finding a 5-year-old child who had been there and was left home alone. Knowing this, how long would these children have been left home alone if we wouldn't have tried to identify them on the backside? We also talk about lack of necessities. This is another area that I would really like to challenge all disciplines to get educated and more training. What is the definition of necessities by the child welfare standards in your communities? Oftentimes when we're in communities, we will find frustration between disciplines like, hey, we tried to intervene in this child's life and we reported this, and the child ended up staying in the same location, or the child did not receive the services that we thought that they should have received. Well, oftentimes what we feel like should be a necessity for these children does not meet the guidelines of our child welfare system. So getting educated on what the true necessities are within your community are going to be important moving forward in hopes to reduce that frustration.
So violence and domestic violence, we know that there is a correlation between domestic violence and violence in the home and substance use in the home. So we just encourage people to make sure we're looking for both when we're at the house or dealing with a family that at least we have verification that one of those things is going on. We want to make sure that families are getting what they need up front. So getting that information up front will be important. Overlay deaths, a lot of people call them the co-sleeping deaths. Oftentimes they are the positional asphyxiation deaths. We only bring this up because oftentimes those deaths have an underlying concern that substance use impacted or caused that death, or at least was involved. So we just encourage people to be looking into whether substance use had impacted that child's death or was a cause of the death. And if it was, what is your community and what are your disciplines doing in regards to that death?
So keeping in mind, as we've switched from old school, what we would call old school deck, to the new deck, back when we were dealing with meth labs, the loss was easy to identify. It was easy to identify because a lot of stuff ended up going to disposal. With today's stuff, we don't have as much stuff going to disposal, but we know that kids are being affected by loss of homes, loss of school, loss of like stuffed animals, etc. And we want to make sure that we are documenting that loss throughout their life. We also know that we've had an increase in ingestion and exposures. Ingestion and exposures have increased in the substance use and substance abuse that has been occurring across the United States as the prescription drug epidemic has increased, as well as the legalization of marijuana, as some of these items are being crushed up, being left on coffee tables, being reformed into different pills, items that are looking like kid-friendly. And when we talk about the legalization of marijuana, we're talking about Butterfingers that used to be B-U-T-T-E-R fingers and now are being B-U-D-D-E-R fingers with very similar labeling that is very appetizing and intriguing to the children, which has also increased the likelihood of ingestion and exposure. In human and sex trafficking, we know that we are talking about the exact same population. Human and sex trafficking has become part of the drug trade and has been a part of the drug trade for many years.
How do we get to that 100% we were talking about earlier? We have to understand the long-term needs of drug-endangered children and implement appropriate and effective intervention strategy. So we know that these children growing up in these environments are impacted in a variety of different ways. And so they will have emotional problems, behavioral problems, and cognitive problems. So by emotional problems, we're talking about things like anxiety, post-traumatic stress disorder, or PTSD. Complex emotions are going to be shame and guilt. Oftentimes, children don't know what to do with those kinds of emotions. Behavioral problems can include sexually acting out what they've seen, kind of that children see, children do. Oftentimes, we first get contact with the family because of those behavioral problems, whether it's at school where they come in contact with law enforcement. And then cognitive problems oftentimes are what the schools are seeing: the inability to pick up on social cues, difficulty paying attention, being delayed. So I want you to think about this, though. If a child is being identified with cognitive problems at school age, so 5 or 6 years old, imagine that they have 5 or 6 years of missed services. So that early identification, even before they hit school age, is going to be very important for these children as well. So the importance of intervention. A report of child abuse and neglect is made every 10 seconds. So keep in mind that these are just the reports being made. We know that abuse and neglect is happening more often than that. Children who experience child abuse and neglect are 59% more likely to be arrested as a juvenile, 28% more likely to be arrested as an adult, and 30% more likely to commit violent crime. And then 2/3 of the people in treatment for substance use reported being abused and neglected as children. So what we're talking about, and what you guys already are seeing, is the multi-generational cycles of child abuse and neglect, as well as substance use. So we as community members, and you guys as professionals, have an opportunity to make the revolving door stop, or to slow it down, to do things different.
We also know that the importance of intervention is key in these efforts. The earlier the intervention, the more efficient and effective the outcomes. But thank goodness, research and clinical trends also support that potential change throughout life. So in other words, it is never too early to intervene in a child's life or a family's life, but it is also never too late to intervene.
I wanted to provide you some information about National DEC as well. So National DEC is a national nonprofit organization. We've been around for around 20 years. We function as a training and technical assistance center. We also work with federal partners, state partners, local partners, and tribal partners in every state. We work to institutionalize DEC efforts from identification to response to services, and then to support throughout the child's childhood and their lifetime. We assist with development of promising practices, which we share across the country. We partner on grants and funding. One of our primary, we call it promising practice, and we're going to talk about that in a minute too, is we help develop alliances to institutionalize effort.
So as part of institutionalizing the DEC effort, we have created a roadmap and toolkit that can be found online on our website, which is www.nationaldec.org. And if you click on the roadmap and toolkit section of things, it is designed to be a user-friendly application or tool to help in the awareness, the implementation, and the institutionalization of forming a local or tribal DEC alliance.
So what is working across the country in our alliances? So going through what Eric just talked about, the road mapping toolkit highlights awareness, implementation, and institutionalization. So awareness is making more people aware of the problem, so providing information. We are seeing folks in alliances across the country really kind of think outside the box as to what this awareness piece can look like. So they are developing social media, QR codes, phone applications, fact sheets, brochures, doing tons of different trainings for different professionals, different community members. Also, one of the things that you'll find in the roadmap and toolkit is the assessment of the community, or community assessment. And we're not talking about reassessing your communities, because those communities have already been assessed. You have data from different disciplines. We're just talking about gathering the data and figuring out what it says. Where are the strengths? Where are the gaps? Where are the weaknesses? And what do we need to do from there? The implementation piece is really a piece where folks are starting to identify where and what they can help. So one of those pieces is the collaboration with more disciplines. We're seeing more people being brought to the table in a variety of disciplines, thinking outside the box as to who can be involved and at what level, because every discipline has something to offer the alliance and these children and these DEC efforts, but they also need things from other people as well. So we're seeing our alliances really think outside the box as to who we can get involved and how we can utilize their information as well. And then identifying and developing promising practices. It's something that National DEC does across the nation, but we're also seeing our local and tribal alliances really developing some of the promising practices across the nation, in their communities as well. And then when they share those promising practices with National DEC, we then take it to the next community and share it because it might work in that community as well. So that's the idea of identifying, developing those promising practices. And then the institutionalization portion is really putting things into place that will outlive the epidemic. So how can we institutionalize it so DEC efforts will be here in 5 years, so it'll be here in 10 years, so it'll be here in 100 years. Always thinking that that foundation and that institutionalization will address the next epidemic as well, because we may be seeing and dealing with heroin in this community. We know methamphetamine might be coming behind it, or it might even be something different after that. So included in the institutionalization is developing MOUs, which are the memorandums of understanding, and the protocols, and then bringing disciplines together. Changing laws and policies as to how this looks and how we can respond, how we can change the trajectory of these children's lives at the policy level. And then setting up the multidisciplinary alliances to continue to address the issues as well. So you'll notice when you go to our website, which is nationaldec.org, that you will, in clicking on the link to the roadmap and toolkit, you'll find easy links to example MOUs, example protocols. We have made these things really easy for folks, or have tried to make them easy for folks so you don't have to reinvent the wheel. They're free to download. You can add your logo and kind of make them your own as well. But we've tried to make them easy peasy for you guys to institutionalize those. So we're going to kind of just briefly give you some examples of some of the work that we have done across the nation to assist folks in developing DEC efforts. So Carbon County, Wyoming invited us to do some DEC training because they were having some collaboration issues, mainly between law enforcement and child welfare after a horrific fatality. So we had provided some training, and you could definitely tell that there were some collaboration issues even during the training. We had gone there on 3 different occasions in a 6-month period, and you could definitely see the switch from the beginning to the end, just in providing some of that information. And some of the trainings, we get people talking about what some of those issues are and how we can do things different. And that, in our opinion, kind of opened up people's eyes as to, okay, this needs to look different for children, or we're going to have another fatality. So with that, during that 6-month period, they had formed an alliance, which was about 45 to 60 different folks coming to the table, which is a lot, but it was great. They also, within that 6-month period of time, implemented the Handle with Care program, which is also a DEC promising practice out of West Virginia. And they expanded upon that to include all different disciplines. They also sat down with law enforcement, child welfare, and the civil judicial system and came up with a fact sheet for law enforcement and child welfare to identify these children and respond differently. So it was a check sheet to help them better assist those children. So Tioga County, Pennsylvania, different makeup than Carbon County, Wyoming, still rural, but definitely different issues. They were seeing an increase in substance use across the board. So child welfare, law enforcement, medical, teachers, and they really honestly didn't know how to bring people together and what to do when they brought them together. So we did some DEC training on multiple occasions, and then really focused in on who to bring to the table and what we were bringing them to the table for. So forming that alliance. After several meetings that we helped attend, or that we attended and helped at, they had about 25 folks coming to the table from various disciplines, and we're focusing on identifying the children at the earliest point, and then what they were going to do to respond to those children from various disciplines, including child welfare, law enforcement, medical, and teachers. And then in Polson, Montana, was a little bit different. We worked with the Confederated Salish and Kootenai tribes, and the city of Polson, which is encompassed in that reservation as well, but is not tribal. So we worked with them over a 3-year period, which is a little bit different. They had applied for a CTAS grant at the federal level, so a coordinated tribal assistance grant that allowed for National DEC to come in over a 3-year period, provide training and technical assistance, but we also helped them complete a community assessment, tribal action plan, setting up the alliance and running meetings and doing those kinds of things, gathering data, and really moving that tribal action plan forward. So they had focused on collaboration, so increasing collaboration through protocols and MOUs, and really bringing different disciplines to the table to think outside the box as to how they could identify these children. And then they focused on housing as well as treatment. So those were the two big ones that they're still working on and moving forward through the tribal action plan. So just kind of giving you different ideas and examples of the work that we do across the country, whether it's at a state, a local, or a tribal level, but also some of the work that folks are doing in communities, because what we want to do is we want to support their work and help them move it forward and help facilitate some of those tough conversations around some of these issues as well. So we talked about promising practices. We're just going to kind of give you a couple examples. The QR code, so that's, if you're not familiar with that, it's that funny looking box that people find places where you can click your phone camera on and it sends you to a link. So one of our Florida local DEC alliances developed a QR code for crisis intervention information. So they handed the QR code out to law enforcement, child welfare, fire and EMS. They had it on side of ambulances. So if somebody overdosed, if somebody had contact with one of those agencies, they could hand them a card, they could click on the QR code, and it would literally send them to a page on a website that had crisis information so they could connect with somebody, so they could get themselves into treatment, so they could know where some of those services were. So I think people are thinking outside the box as to how we can get people information when maybe we don't even have contact with them. Fact sheets, we talked about that out of Wyoming. Folks are developing different kinds of fact sheets. How can we get the information out there to folks, but also how we can link people together as well. And National DEC has some great fact sheets on evidence collection, prenatal substance exposure, and so on. That also is included in the roadmap and toolkit. Phone applications, people are getting creative with that as well. Handle with Care, you can get more information on that through our website or through contacting us. Informational publications, obviously just getting information out there. Online DEC training, and then online virtual training. We actually have some new online training that's going to be coming out here shortly through the COPS office, so keep an eye out for that. And then just developing DEC alliances. We know that we have to institutionalize efforts, and that is one of the ways that we help do that across the country. So I think that is all that we have. So we thank you. Obviously, we can be reached through National DEC at nationaldec.org, and our contact information, both Eric's and mine, is on our website as well, so you can get in touch with us at any point in time.
That concludes this episode. Thank you all for not only taking time to listen, but for your continued work making our community safe, healthy, and drug-free. If you'd like to know what trainings we have coming up, check out our website at pttcnetwork.org. There you can subscribe to our monthly newsletter and get the latest, greatest delivered right to your inbox each month. And a big shout out and thank you to our friends at the National Alliance for Drug Endangered Children. Thank you very much for being amazing partners and doing what you do. And remember, prevention is better together. And together, we are stronger. Thanks for listening, and we'll catch you on the next episode.